Hi, anaphylaxis is a life-threatening allergic reaction which requires immediate management to prevent severe outcomes including shock and organ injury. Anaphylaxis management therapy includes immediate actions. We have to remove the trigger immediately if possible, stop the exposure to allergen. For example, removing insect stingers, stopping the medication infusion, call for help, assess the airway breathing circulation, monitor the saturation of the oxygen, check for signs of shock and hypotension and tachycardia. This is the first aspect. Second line aspect, first line treatment includes epinephrine or adrenaline, IM injection of 0.3 to 0.5 mg in anterolateral thigh for adults. Repeat every 5 to 15 minutes if no response or worsening symptoms. Auto injector EpiPen can be used, but IV infusion may be used only in controlled ICU settings. There is no contraindication for life-threatening anaphylaxis for adrenaline. And adjunctive therapies, we have to position the patient, we have to administer high flow oxygen, fluid resuscitation should be done if there is hypotension or signs of shock. 1 to 2 liters of IV normal saline can be given. Antihistaminics, H1 blockers, diphenhydramine and cetirizine can be used. Corticosteroids, methylprednisolone or prednisolone can be used. Bronchodilators, albuterol or salbutamol can be used. If purpose is it relieves airway obstruction not fully resolved by epinephrine. Monitoring and observation, we have to monitor the vital signs, BP, heart rate, respiratory rate and saturation, oxygen saturation. Observation period 4 to 8 hours and longer for severe cases due to the risk of biphasic anaphylaxis. Cardiac monitoring has to be done. We can do an ECG to detect arrhythmias or ischemia. Management of refractory anaphylaxis, persistent hypotension, we have to escalate to IV epinephrine. We can use vasopressors also in ICU setting. If there is airway compromise, we have to do early intubation. Post anaphylaxis care, we have to do allergy evaluation by an allergist. We have to prescribe an EpiPen. A written anaphylaxis action plan should be given to the patient. We have to educate the patient. Thank you.